they're getting the word out about a sexually transmitted form of ringworm that's newly made its way into the U.S. So far, there's one reported case, and it is here in New York. CBS 2's Christy Kalishian shares what doctors know so far.
Trichophyton mentagrophytes type 7, which is a sexual transmitted disease, is the latest in a group of severe skin infections to have now reached the United States. It started in New York when a man visited his doctor because of a rash in his groin.
It's an infection that comes from the same fungus linked to conditions you may know of, like ringworm, jock itch, and athlete's foot.
What makes this case a little bit different is it is a type of ringworm that can cause more inflammatory type lesions, and it can occur in the groin area or the genital area.
Dr. Avram Kaplan led the study and authored a report published in the journal JAMA Dermatology earlier this week on Trichophyton mentagrophytes type 7, or TM7. It's a sexually transmitted infection that can appear like this in the groin area and can be itchy. So far, the one reported case in the U.S. is in New York City. A man in his 30s, the report says.
It was reported in a journal, which tells you that it's new. We're still learning about it. Because it's just this one case, I think we're really starting to understand how could this have happened.
The study says the patient noticed itchy lesions after a trip to England, Greece, and California, where he said he had sex with multiple male partners. Cases popped up last year in France. Earlier ones were linked to those in contact with sex workers in Southeast Asia.
The rash may look more like an eczema flare than a ringworm infection, which usually forms in a circular pattern on skin. The dermatologist said the infection is not fatal but can cause permanent scarring. People with sudden rashes may want to see a healthcare professional if the rash appears in the weeks following sexual activity or after travel to Southeast Asia or Europe, where this fungus has been increasingly diagnosed. Be sure to like, comment, and subscribe.